Why wait so long to have a baby? Today we're going to talk about why heart attacks cause so much more damage in late pregnancy. This article was published in the Medical News Today on July 4th of 2012. Heart attacks during pregnancy are not common, but over the past year has been increasing. It usually increases when women delay their pregnancy. The article mentioned that older women tend to have less physical activities, and it makes it higher to have high cholesterol and greater risk of heart disease and diabetes. There has been several investigations and research about the theme and has mentioned that heart typically functions better during pregnancy due to a rise in cardiac pumping capacity to meet increased demands. Investigators utilized rats and mice for a study in which stated that heart attacks occurring in the last trimester of pregnancy resulted in worse heart functions and more damaged heart tissue than heart attacks among non-pregnant females. Investigators assessed heart differences after heart attacks among late-stage pregnancy female rats and non-pregnant groups. Dr. Jingwan, a postdoctoral fellow in the Department of Anesthesiology at the Geffen School of Medicine, mentioned that they had observed worse heart function and a greater area of damage in heart from the late pregnancy group compared to the non-pregnancy group. The investigators took a closer look to see what mechanisms were behind the heart inability to effectively recover after such cardiac event in late pregnancy. It has been stated that in late pregnancy, several components of the process are especially aggravated. Let's take a look at the risk and effect of having a late pregnancy. After a heart attack caused by a lack of blood flow to the heart, the reintroduction of blood to the affected area can lead sometimes to heart problems. When the blood hits the oxygen-starved tissue, it can result in a sudden increase in oxygen radicals that can cause cell damage. Usually, pregnant women are safeguarded from the effects of heart disease while they are carrying their children, mostly because the heart operates more efficiently to handle blood increase and blood demand. However, since expecting women are older now, they also have a higher cholesterol and can affect the valves and the mechanism valves that also pose serious risk during pregnancy due to the just use of blood thinners and potential for life-threatening clotting of heart valves. Approximately 90% of patients with Marfan syndrome experience changes in their heart blood vessels. The most serious problem with Marfan syndrome is the weakness of aorta. Let's mention the precautions that we have to take to have a safe pregnancy. Start a preconception appointment. Your healthcare provider will evaluate how well you are managing your health condition and consider any treatment changes you may need to do before you get pregnant. Another thing is get plenty of rest. Follow your healthcare provider recommendation for exercise and activity. For some types of heart conditions, bed rest may be recommended. Eat a healthier diet. Avoiding excessive weight gain is particularly important. If you have a heart condition, extra weight places additional stress on the heart. If you have rapid palpitation or irregular pulse, you should visit a cardiologist. Keeping all these precautions, we can expect having a healthy pregnancy. As we discussed previously, we can have difficulties in the late pregnancy with high cholesterol and that could cause diabetes. Also, with a high blood pressure can affect heart palpitations and arteries, and what to do if you have any symptoms that might harm you or the baby. I understand that this medical theme was extremely important to me, and this is why I decided to talk about it. It is important to know that if we wait longer in having the baby, there are more chances of having a complicated pregnancy. It is important to read medical articles at least once in a while in order to have a better understanding of the news updates in regards to medicine as well as medications needed to improve your life to a better step. It's really important to know all the risks to the late pregnancy. Today we have pointed out all the risks that can affect late pregnancy and how we can take care of ourselves if we are in that situation. By balancing and following the doctor's recommendation will allow us to have a healthier life as well as the baby.